Imagine a world where diseases are caught years before they show symptoms. Surgeries are guided flawlessly by robots, and treatments are personalized down to your very genes. Welcome to the age of AI in healthcare, the revolution that's not just coming, but already here. We're taking a deep dive today into the transformative power of artificial intelligence in medicine. What felt like science fiction? Well, it's rapidly becoming how healthcare gets done.
It really is an extraordinary period of change. I mean, consider this. In the US, the number of physicians actually using AI, it jumped from about 38% in 2023 to nearly 66% in 2024. That's a huge leap in just 1 year.
Wow, 66%.
Yeah, and it's not just doctors. Get this, 94% of health executives expanded their AI efforts during the COVID-19 pandemic. So, even under pressure, they saw the value.
Okay, so this isn't just incremental change. It feels like a real acceleration. What's really behind this shift from maybe experimental tech to something becoming, well, essential?
Well, it's kind of a perfect storm of factors converging. You've got massively increased computing power that's also more affordable. At the same time, there's just this explosion of data, especially from electronic health records, EHRs, digital patient histories.
Right, the raw material for AI to learn from.
Exactly. Millions of real-world cases for these algorithms to train on. And the algorithms themselves, particularly deep learning, they've gotten incredibly good at finding really subtle patterns in all that data. Patterns humans might easily miss, especially in things like medical images.
So better tools, more data to feed them.
Precisely. And that progress is why we're seeing this huge surge in AI and machine learning medical devices getting the green light from the FDA. By late 2024, we were looking at over 1,000 such devices cleared for use. Just think, a decade ago it was barely a handful.
1,000 FDA-cleared devices. That really paints a picture of the speed here. And you mentioned the U.S., but this isn't just happening stateside, is it?
Oh, not at all. The U.S. has definitely been quick with regulatory approvals, but Europe and Asia are right there too, integrating AI. Take the UK, for example. By the end of 2023, literally every single stroke center in England was using AI to help read brain scans. That's a specific system called Brainomix eStroke.
Every stroke center, that's nationwide adoption.
Pretty much, yeah. And in China, they've made AI in hospitals a national priority. They had, I think, over 90 AI medical devices approved by their regulators by mid-2024. So it's definitely a global phenomenon, even if the specific applications or, the rules look a bit different from place to place.
Okay, so for our deep dive today, let's focus on some of the most, compelling parts of this revolution. First, how AI is starting to spot diseases sometimes even before doctors can see the signs. Then the big question, can we actually trust AI with something as critical as our health? And finally, we'll look ahead. What's next? Could AI become like a personal health companion for each of us? So let's dive into that first area, AI finding diseases in ways that maybe weren't possible before.
Right. And this is really where AI's knack for pattern recognition just shines. It's making a huge difference in diagnostics. Think of it as an assistant, sometimes a really crucial one, or even in certain specific cases, operating somewhat autonomously.
And it seems particularly strong with images, radiology, pathology.
Exactly. It's ideal for image analysis. Radiology, pathology, dermatology, these fields are seeing massive changes.
You mentioned radiology is leading the charge. I read somewhere that a huge chunk of the FDA-cleared devices are for radiology.
That's absolutely right. About 75% of all FDA-cleared AI medical devices fall into radiology. These AI tools can scan X-rays, CTs, MRIs really quickly, spotting tiny abnormalities, things that might be subtle or easily overlooked by the human eye, especially under pressure or during routine screenings.
So it helps radiologists focus their attention.
Yes, or it handles the high volume, maybe more routine stuff. And the impact, well, it can be really significant.
Like that MSII study in Sweden, that really caught my eye. Using AI with mammograms boosted cancer detection by almost 30%.
Yeah, nearly a third more breast cancers found. And critically, often at earlier, more treatable stages. That's the key takeaway.
A third more detected earlier. That's huge for patients.
It absolutely is. Earlier intervention generally means better chances, simpler treatments. It's not just about finding more cancer, it's finding it sooner. And it's not just screenings. AI is also used for, say, triaging chest x-rays. It flags urgent findings like pneumonia or collapsed lungs so those patients get seen immediately.
And we already touched on the UK stroke example, which is just incredible.
Right, the Brainomix system. AI helping interpret brain scans, identifying the stroke, suggesting treatment options. It cut the time from hospital arrival to treatment by over an hour on average.
Over an hour faster in stroke care, that's life-changing.
It really is. And the results speak for themselves. They saw the percentage of patients recovering with little or no disability triple. It went from 16% to 48%.
Wow, from 16 to 48%. That's a direct link between AI and drastically better patient outcomes.
Exactly. Where every minute counts, AI is making a measurable positive difference.
And this isn't just radiology, you said. Pathology has seen changes too.
Definitely. Pathology is another big area. You combine digital pathology, basically, high-res scans of tissue slides, with AI analysis. It helps pathologists dig deeper, find patterns indicative of cancer or other diseases.
Wasn't there an FDA-approved AI for prostate cancer? Page Prostate, I think?
That's the one. It was the first FDA-approved AI for pathology back in 2021. It essentially acts like a second reader, helping catch potential prostate cancer in biopsies.
A digital second opinion.
Kinda, yeah. It helps reduce errors, improves diagnostic accuracy. It's a safety net, a valuable tool for the pathologist. And this is becoming more important because, well, unfortunately, cancer cases are projected to rise significantly, maybe 60% globally in the next 2 decades.
60% increase.
That's the projection. And at the same time, the number of pathologists per capita is actually declining in many places, so there's a looming workload challenge.
So AI could help bridge that gap, handle some of the workload without sacrificing quality.
That's the hope. AI can help process slides, flag areas of concern, and pathologists seem open to it. A survey showed something like 72% expect accuracy. AI will help them analyze data and even predict patient prognosis.
Beyond slides, can it look at other lab data, blood tests, genetics?
Yes, absolutely. AI is being used to analyze complex lab results, sift through genetic data, looking for abnormalities, potentially identifying rare diseases that are hard to diagnose. It expands our toolkit.
Okay, so radiology and pathology are big. What about other areas? Dermatology, eyes, heart?
Good question. Yes, it's branching out. In dermatology, you have AI algorithms looking at photos of skin lesions. Studies show they can classify lesions, including melanoma, with accuracy matching, or even sometimes beating experienced dermatologists.
From a photo.
From a high-quality photo, yeah. And think about accessibility. AI-powered smartphone apps are emerging that could offer initial skin cancer screenings. Gets it out to more people.
Interesting. And ophthalmology, eyes.
There's a really key example there, the IDX-DR system. It's FDA authorized to autonomously screen for diabetic retinopathy. It analyzes photos of the retina, right there in a primary care setting, and tells the doctor if the patient likely has referral disease, meaning they need to see an eye specialist.
And the primary care doctor can use it without needing an ophthalmologist right there.
Exactly. Its performance, in terms of sensitivity and specificity, is similar to human experts. Basically brings specialist-level screening into the primary care office, which is huge for catching diabetic eye disease early.
That really democratizes access to that kind of screening. What about cardiology?
Cardiology, too. AI interpreting EKGs, heart rhythm tests, and echocardiograms, which are ultrasounds of the heart. You even have FDA-cleared AI on consumer devices like the Apple Watch, alerting users to potential irregular heart rhythms like atrial fibrillation since 2022.
Right, I've heard about that.
And there are clinical tools, too, like Ultramix EchoGo, analyzing echocardiograms to help diagnose tricky conditions like heart failure with preserved ejection fraction.
And I've even read about research using AI to analyze what? Voice recordings or coughs.
Yeah, that's more cutting-edge research, but very promising. Trying to detect signs of respiratory conditions like COVID-19 or even neurological conditions like Parkinson's just from subtle changes in voice or cough patterns. Early days, but fascinating potential.
So summing up this first part, it really feels like AI is becoming this powerful diagnostic ally across medicine. It's tireless, super fast, spots things humans might miss, especially in imaging.
That's good summary. It's augmenting clinicians, helping them be more effective, more efficient. Radiology is clearly leading, pathology is coming up fast, and other specialties are finding valuable uses too. Earlier interventions, like with stroke, are a major benefit. It's not perfect, obviously, but it's a game changer.
Okay, so the potential is clearly enormous, but that brings us squarely to the next big question. With AI making inroads into life and death decisions, can we really trust it? How do we navigate the ethical side of this?
That is the crucial question. The excitement is palpable, but we absolutely need to be critical and address the challenges. Trust is foundational.
Let's start with the data itself. AI needs vast amounts of patient data to learn. That's incredibly sensitive information. How do we protect patient privacy?
Paramount importance. We're talking about ABA in the US, stringent regulations elsewhere. AI training requires these large data sets, often containing very personal health details. There have been controversies like Project Nightingale with Google and Ascension, where huge amounts of identifiable patient data were shared, raising concerns about transparency and consent.
Right, that caused quite a stir, the idea that data might be used without explicit permission.
Exactly. It eroded trust. Plus, there's always a risk of data breaches, misuse of information, so the ethical imperatives are clear. Really robust methods to de-identify data, strict controls on who can access it, and absolute transparency with patients about how their data might be used for AI development.
Are there technical solutions being explored?
Yes, things like using synthetic data, artificially generated data that mimics real data patterns, or federated learning, where the AI model trains on data locally at different hospitals without the raw data ever leaving those institutions. These could help, but vigilance is key.
And what about data from, say, our wearables, fitness trackers, health apps? Could insurance companies use AI to analyze that? Where are the boundaries?
That's a very live debate. The lines are blurring. Maintaining patient confidentiality and control over personal health data, wherever it comes from, has to be the bedrock.
Okay, privacy is one major pillar of trust. What about bias? If AI learns from historical data, doesn't it risk learning historical biases too?
That is a huge concern and a well-documented one. AI models learn the patterns in the data they're trained on. If that data reflects existing societal biases, racial, gender, socioeconomic, Asian, the AI can, and often does, perpetuate or even amplify those biases.
Can you give an example?
Sure. There was a widely cited study in 2019 that looked at a hospital algorithm used to identify high-risk patients needing extra care management. It turned out the algorithm was significantly biased against Black patients. It used healthcare costs as a proxy for health needs, but because Black patients historically incurred lower healthcare costs for the same level of illness due to access issues and systemic inequities, the algorithm wrongly flagged them as lower risk.
So it was under-referring Black patients for beneficial programs based on biased data.
Precisely. It was making existing health disparities worse. And you see similar concerns in imaging AI. If an AI for detecting skin cancer is trained primarily on images of light skin, it might perform poorly on darker skin tones. There are real worries about some AI dermatology tools having lower accuracy for people of color.
That's incredibly serious. Algorithmic bias becomes a patient safety issue.
Absolutely. The ethical mandate is clear. AI should help reduce health disparities, not exacerbate them. This means we need diverse and representative training data sets, rigorous testing for bias, and developing methods for algorithmic fairness correction. Regulators are starting to push for this, asking for evidence of fairness.
So it requires conscious effort to build equitable AI.
Continuous effort, monitoring performance across different demographic groups, involving diverse stakeholders in development and testing. Non-discrimination has to be a core principle.
Another challenge often mentioned is the black box problem. Sometimes AI reaches a conclusion, but we don't know how. How can doctors or patients trust a recommendation they can't understand?
That's the transparency and explainability issue. Many powerful AI models, especially deep learning ones, operate in ways that aren't easily interpretable by humans. It's hard to trace the exact reasoning paths.
And that's a problem for trust.
Definitely. Doctors need to understand why an AI is suggesting a certain diagnosis or treatment to feel confident incorporating it into their decision-making. Patients also deserve to understand the basis for recommendations affecting their health. It ties into informed consent and patient autonomy. Plus, a lack of explainability can hide errors. There was a famous case where an AI seemed great at spotting skin cancer, but it turned out it was basing predictions on whether the photo included a ruler, which doctors often place next to suspicious lesions.
Oh, wow. So it learned a shortcut, not the actual medical pattern.
Exactly. Without transparency, you might not catch that kind of spurious correlation. That's why there's a big push for explainable AI or XAI techniques, like generating heat maps on images to show which areas the AI focused on.
Are regulators interested in this?
Very much so. The EU AI Act, for instance, is likely to mandate certain levels of transparency for high-risk AI systems, including medical ones. The FDA is also encouraging interpretable algorithms. This links back to the idea of augmented intelligence. AI working with clinicians, providing insights that the human can verify and understand. Studies show doctors are much more willing to use AI if they get clear feedback and understand its reasoning. Okay, so if an AI does make a mistake, despite all the checks, who's responsible? If an AI misses a cancer diagnosis, or maybe a doctor overrules a correct AI suggestion and the patient is harmed, where does the buck stop? That's the accountability and liability question, and honestly, it's still being worked out legally and ethically. Traditionally, the clinician holds primary responsibility for patient care decisions.
Does using AI change that?
Currently, AI recommendations generally don't absolve the clinician of responsibility. They're seen as tools, decision aids. But as AI becomes more autonomous, that line could blur. What if the standard of care eventually requires using AI for certain tasks?
That's complex. What about the AI developers, the manufacturers?
They certainly have responsibility for validating their products, ensuring they perform as intended, managing updates, and being transparent about limitations. The FDA does issue recalls for faulty medical software, including AI. There was a case of a radiology AI that sometimes flipped images, clearly a manufacturer issue. We might see future legal frameworks emerge, maybe safe harbor standards if AI tools meet certain criteria, or requirements for AI companies to carry specific liability insurance. Regulatory oversight, like the FDA's evolving methods for monitoring AI performance over time, is also key.
So patient safety remains the absolute priority. High standards for AI, clear consequences for failure.
Absolutely. It requires an expanded notion of accountability involving developers, institutions, and clinicians, all focused on protecting the patient.
One last area related to trust, the human element. How does AI impact the roles of doctors and nurses and the patient experience itself? Are people worried about AI replacing healthcare professionals?
That's a common concern, yes. Job displacement. Most experts, though, predict AI will augment human roles rather than replace them outright. It might handle routine tasks, data analysis, freeing up clinicians for more complex problem solving and direct patient interaction.
But could there be downsides, like doctors becoming too reliant on AI, maybe losing some of their own diagnostic skills over time, de-skilling?
That's a valid risk. There needs to be a balance. Integrating AI into training, but also emphasizing critical thinking, knowing when to question the AI, maintaining core clinical skills. It's about using AI wisely, not blindly following it.
And what about patients? How do they feel about AI playing a bigger role in their care?
It's mixed. Some patients are enthusiastic about the potential for faster, more accurate diagnoses. Others are wary, concerned about losing the human connection, the empathy, the face-to-face interaction with their doctor.
The human touch.
Exactly. The hope is that AI, by handling administrative burdens or initial analyses, actually frees up clinician time for more meaningful patient interaction. But that's not guaranteed. Public surveys show this ambivalence, maybe 70% worry about rushed adoption, but 75% also see a future role for AI.
So it's crucial to keep the patient perspective front and center.
Absolutely. Informed consent when significant AI is involved, ensuring patients understand its role, respecting patient autonomy, maintaining shared decision-making. The goal should always be to enhance the patient experience and health outcomes, preserving that vital human element of care.
Okay, we've covered the diagnostic power and the critical trust issues. Now let's look ahead. What does the future hold? Where is this all going? Is it really heading towards AI as a personal health companion?
I think the trajectory is definitely towards deeper integration and much more sophisticated capabilities. AI won't just be an add-on, it'll be woven into the fabric of healthcare.
So more widespread use.
Absolutely. Within the next decade, expect AI to be a common tool, not just for doctors, but for pharmacists, physical therapists, nurses, pretty much all health professionals. There are projections that over 90% of hospitals might be using AI for things like early diagnosis or remote monitoring as soon as 2025.
90% by 2025. That's practically tomorrow.
It reflects the momentum. Expect AI built into routine equipment. Think smart stethoscopes, smart otoscopes. Radiology and pathology might reach near full AI integration for initial analysis relatively soon. AI will shift from being a separate tool to being an integral part of the workflow, feeding insights directly to clinicians. Big tech companies and startups are pouring investment into this space.
And this could help manage the growing demand for healthcare.
Potentially, yes.
Yeah.
AI could help handle increasing workloads without needing proportional increases in human staff or costs. It could also be a way for low and middle income countries to potentially leapfrog, adopting advanced diagnostic capabilities faster. The WHO is actually working on guidelines for safe global adoption.
A sort of AI-augmented global healthcare system.
That's the vision. Optimizing who does what, human or machine.
What about the AI itself? Will it get smarter, more versatile? We hear a lot about generative AI, like GPT-4.
Definitely. Generative AI and large language models, LLMs, are poised to play a huge role. We're already seeing pilots integrating models like GPT-4 into electronic health records. Microsoft and Epic are working on this.
For what kinds of tasks?
Initially, things like drafting clinical notes based on conversations, summarizing patient histories, even helping respond to patient messages. Early trials are happening at places like UW Health and Stanford.
So automating some of the documentation burden.
Exactly. Ambient AI listening to appointments to automatically generate notes, maybe even draft test orders or assist with billing codes, that could free up significant clinician time. Beyond documentation, think about clinical decision support. Conversational AI that can answer complex medical questions based on the latest evidence suggests potential diagnoses based on symptoms. Some studies show these LLMs performing surprisingly well, sometimes even outperforming physicians on text-based diagnostic challenges.
Wow. So smarter decision support. What else?
Multimodal AI. Systems that can analyze not just text, but images, lab results, genomic data, wearable sensor data, all together for a truly holistic view of the patient.
And those digital twins you mentioned earlier.
That's a bit further out, but a really exciting concept. Creating a personalized computational model of a patient, updated with real-time data from wearables or sensors. You could use it to simulate how different treatments might affect that specific individual before actually administering them. Maybe used for high-risk patients or complex conditions by the late 2020s.
Simulating treatments on a virtual you, that sounds like sci-fi.
It does, but the building blocks are developing. More computing power, potentially quantum computing down the line, will enable even more complex models. Think about AlphaFold successfully predicting protein structures. Similar breakthroughs driven by AI are likely in understanding biochemical pathways, maybe even designing gene therapies. AI is moving from narrow tasks towards more generalist capabilities.
Okay, so AI is getting smarter, more integrated into the professional workflow. What about putting AI more directly into the hands of patients? That personal health companion idea.
That's another major trend. Empowering patients for self-management. We already have AI-powered health apps for things like nutrition tracking, exercise coaching, medication reminders.
But the future is more personalized.
Much more. Imagine AI monitoring your mental health state based on subtle changes in your phone usage or voice patterns. Or home diagnostics becoming commonplace: smart toilets analyzing waste, smart mirrors scanning skin, advanced sensors and smartwatches non-invasively monitoring blood glucose or hydration.
And all that data feeds into
Your personal AI health coach, continuously monitoring, providing proactive nudges, personalized advice, early warnings. It could enable a real shift from reactive sick care to continuous proactive health management.
That sounds amazing, but also raises those privacy questions again, even more intensely.
Absolutely. Data security, consent, oversight, regulation of these direct-to-consumer AI health tools will be critical. We'll also need AI to help improve health literacy, explaining complex medical information in simple, understandable terms. Maybe even AI-driven patient communities for support.
So the vision is everyone having a sort of AI health concierge working alongside human doctors.
That's a possible future, yes. More predictive, precise, personalized, and participatory medicine, the 4Ps potentially becoming reality by the 2030s.
For all this to work, though, these different AI systems and existing hospital systems need to talk to each other, right? Integration seems key.
Crucial. Interoperability is a huge challenge, but also a huge priority. We need better standards like SMART on FHIR, so AI tools can seamlessly connect with EHRs, medical devices, data exchanges.
So AI results just become part of your standard medical record.
Ideally, yes. Maybe an AI note section in the EHR, and different AI systems coordinating, for example, a radiology AI detecting something suspicious might automatically trigger an order for a follow-up scan and update the patient's record. Orchestrated workflows.
And regulation needs to keep pace with all this rapid development.
It has to. We're already seeing regulators like the FDA adapting, developing frameworks for how to approve and monitor AI that learns and changes over time these adaptive algorithms. They've proposed things like predetermined change control plans.
So the AI can be updated without needing fresh approval every single time, as long as it stays within agreed boundaries.
Something like that. Expect future regulations to increasingly require robust demonstration, not just of efficacy, but also fairness, transparency, and explainability. Europe's AI Act will likely have a global ripple effect. We might see international standards like for MISO for medical AI.
And legal frameworks for liability, professional guidelines, even medical school curricula will need to adapt.
All of the above. Future governance will be about maximizing the immense benefits while minimizing the very real risks.
Are there any other, maybe more speculative breakthroughs on the horizon?
Well, combining AI with robotics for surgery or rehabilitation is advancing rapidly. AI paired with brain-computer interfaces to restore lost function. AI driving discoveries in genomics for truly personalized gene therapies. Using AI in public health to predict disease outbreaks or model the impact of health policies. The potential applications are incredibly broad.
So wrapping up our look ahead, feels like we're truly entering a new era. Wider adoption, smarter systems, a deeper partnership between humans and machines in healthcare.
It really does. The momentum is undeniable. The projected market growth is staggering, from maybe $27 billion in 2024 to potentially over $600 billion by 2034. While challenges remain, especially around trust and equity, the potential for more timely, effective, and perhaps even more equitable healthcare is immense. Patients ultimately need to remain at the center of it all.
This deep dive has really illuminated just how profoundly AI is set to reshape healthcare, from the doctor's office to our own homes.
It's a fascinating and incredibly important transformation to watch.
So, a final thought for you listening. Consider how this increasing integration of AI into the most personal aspects of our health might reshape not just medical practice, but our very understanding of well-being and that fundamental doctor-patient relationship. What are you most excited or perhaps most concerned about in this rapidly evolving landscape?
It's definitely something worth reflecting on as this technology becomes more embedded in our lives.
We really hope this deep dive has given you a clearer picture of the transformative power, the promise, and also the challenges of AI in healthcare. If you found this discussion insightful, please do follow and share our channel. It helps others discover these deep dives and join the conversation.